Okay, so welcome to Eat, Move, Think, the show about optimal wellness brought to you by Medcan.
Wow. Do it again.
Oh, I was practicing.
Okay, ready?
Welcome to Eat, Move, Think,
the show about
optimal
wellness brought to you by
Medcan.
Yeah, this is extremely good. Thank you.
Episode 146. What's on the agenda today?
I mean, what's on the agenda every week? We're talking about wellness.
Wellness.
Yes. So when you think of wellness, top 3 things, what do you think about?
Eat, move, think. I think about, plant forward diet. I think about exercising as much as possible. And on the think front, for me, the biggest factor is how much I sleep. So if I get 7 hours, I'm feeling pretty good.
Yeah. I think about also making sure you go to the doctor, you know your family history, prevention and things like that. And those are definitely the types of things that we talk about on Eat, Move, Think.
Totally.
But healthcare is also about the way we look.
Sure. Okay.
Because the way that we look definitely has an effect on the way that we feel.
I went to Florida recently. I got a bit of a tan.
So you feel great.
Yeah, a little color.
Yeah, I think the saying look good, feel good exists for a reason. It's very real.
So now let's bring Medcan Refine into it, which is Medcan's full-service dermatology clinic.
Yeah, they have a state-of-the-art team. They have dermatologists and estheticians there. And so today, Refine is taking over Eat, Move, Think to answer questions from you, from clients, from listeners about
holiday skincare.
Yeah.
What to do and how to look your best over the holidays. I'm Chris.
I'm Jazz. We're the producers of Eat, Move, Think.
In today's episode, we have Refine Medical Director Dr. Jonathan Levy and Refine esthetician Lesley Bray tackling some of your biggest questions about your skin. We threw this over. How did we get these questions?
They were submitted to us on our email address, info@eatmovethinkpodcast.com.
But before we get to the actual episode, we want to mention a promotional package.
It's the Holiday Glow promo.
When you purchase a package of 4 professional peels, you receive a $190 value Glow Maintenance at-home kit by Zain Obagi.
Comes with an exfoliating cleanser, complexion renewal pads, exfoliating polish, a somatic peel, and a few skin brightening sheet masks.
All right, now let's get to the episode.
Okay, so we're here in the Eat, Move, Think studio. I have Dr. Jonathan Levy with me here. How's it going, Dr. Levy?
Pretty good. How are you doing?
I'm doing really well. I'm excited to be talking about holiday skincare. I feel like every year when winter comes around, I feel like my skin inevitably just gets a little bit worse. So I, for one, am really happy about this. And we have a lot of listeners out there who are also excited about this episode.
Yeah, I'm excited to, answer some of these questions and talk about skincare in general here today.
So Dr. Jonathan Levy is the medical director of Refine by Medcan. Tell me a little bit about what that means.
The favorite part of my job actually is all the different people I get to meet throughout the day. Dermatology is very rewarding for both the patient and the doctor.
Yeah.
Because someone comes in and they got a rash or they got a spot, they see the rash go away. And it's rewarding for the doctor too, because, we see them get better as well.
Yeah, that's exciting.
So it's great.
And today we're also joined by Lesley Bray. Lesley, welcome to Eat, Move, Think. And why don't you tell me a little bit about your role as an esthetician?
I am a paramedical laser technician. My role at Medcan is essentially working with patients to achieve desired results with one of our many modalities of lasers, also professional peels. It's extremely rewarding. And I find, a lot of people don't realize that there are things that can be done. Mm-hmm. So once you show them that there are treatments available and, within a safe, medically supervised position or clinic, they feel very confident and very safe to have something done.
Well, thanks for being here. All right, now it's time to get started with listener questions. The first question comes from Susan.
I'm in my 50s and I have a lot of sun damage. I have some time off this winter break. It might be a good time to get some kind of treatment. What can I get done?
Any ideas, Dr. Levy?
So when we talk about what treatments, one is it's hard to say without seeing Susan here. In this situation, she's got some time off, which is helpful because sometimes, people come in and they say, I want to get this done and I could do it on Friday, but I got meetings again Monday morning type of thing. And, they can only afford up to a couple days of downtime. So having a little more time does give us a little more opportunity to do other treatments. One nice treatment that works well for a lot of people is doing, we call it the power couple. So it's two different lasers. One is called IPL, which is intense pulse light, and the other one's clear and brilliant. So the IPL, what that does is it helps target pigment. So when we have sunspots, like those brown sunspots, it helps target redness. So when we just get little broken blood vessels and just sort of that background redness often in the cheeks or nose or other parts of the face, the IPL is really good at targeting that. And then the clear and brilliant, that's more for overall sort of skin texture and tone and gives a glow. And each of them, maybe can cause a little redness. The IPL, not so much, but more the clear and brilliant. And when you do them both together, it's nice if you had a couple days of downtime. Not that it's terrible, but still helps. So that's a nice treatment that someone can do.
And Lesley, can you tell me a little bit about the process for IPL and clear and brilliant?
Absolutely. So generally, the intense pulse light or IPL treatment would be administered first. IPL is often referred to as almost feeling like a hot elastic band snap on the skin. And the second part of the treatment is the clear and brilliant, which is essentially targeting pores, texture, fine lines. It's very, very tolerable, as you've already had the topical anesthetic applied, so it makes it quite comfortable. The treatment itself takes about 45 minutes. A cooling mask is often applied post-treatment because it will feel comparable to like a sunburn sensation. You feel that for probably about 20 to 30 minutes post-treatment. The days following the treatment, the skin feels rough. So more than looking rough, it feels rough. So it feels a little dry, feels a little dehydrated. So patients will generally just have to up their post-care with added hydration.
And you say they need, how many days around would they need of downtime?
Up to a couple days.
Okay.
Depends on the person. Some people have more sensitive skin, they might need more, but the average person, just that much.
And then Dr. Levy, if I had more time, is there an option that's better suited for a week or maybe even a week and a half of downtime?
So again, it depends how aggressive we want to go. So if there's a much stronger laser called a CO2 laser, carbon dioxide laser. That's a resurfacing laser that you'll sort of be out, for a week or two. Again, depends how many passes you do and how aggressive we go with that laser. But that one is going to give you much better results, but it's sort of that no pain, no gain mentality of just like, all right, it's going to look bad, but you get really good results. Now, not everyone needs that though. So that could be a little bit overkill for some people.
That's really if you're in the more intense cases.
Yeah, that's more if you have more sun damage, deeper lines, that sort of person would benefit the most from it.
And what's the process like for the CO2 laser, Lesley?
Being a laser technician in the industry for a really long time, CO2 is probably one of my favorites to do for someone because it checks all the boxes. We're almost aerating the skin, like when you would aerate your lawn. We're laying down hundreds of thousands of tiny little columns of ablated skin. Most people are fine to resume normal social activity within 5 days of treatment. So the process of CO2 when someone comes in, first we make sure that they're completely comfortable, feeling that they have all the information needed to make an informed decision that this is the best treatment for them. Come in the office, there is a topical anesthetic that's applied. The treatment itself takes about 20 minutes in total. There is quite a lot of heat being sent into the skin, so naturally they would feel almost like their skin is burning. We will cold compress the skin, which pulls a lot of the heat out immediately. Almost all patients comment that that really feels good after the treatment. 4 or 5 days post-treatment, they're sent home with a post-care sheet, instructions on what they're going to do. There is a little bit of swelling post-treatment the next day. Again, they're going to be applying a heavier moisturizer, almost Vaseline-like moisturizer, for the duration of their healing.
Okay. Well, there you go, Susan. A couple of good options for you there. This question comes from Zara.
Hey guys, I love the show. So I'm in my early 30s and I'm starting to notice some fine lines around my eyes and between my eyebrows. So do I have any options for trying to soften the lines but still have kind of a natural look?
It's a great question, and I see this all the time. Probably a couple times a day someone comes in, and they could be in their early 30s. I see they could be in their 40s, 50s, 60s. I've had people 70s, 80s come in with the same concern. And when people start to get these lines, the reason we get them is just from our facial expression. So if you have a more expressive face, which is a nice thing, the downside of that, or not necessarily downside, but one of the side effects of that is you end up getting some lines. And common places where people get them would be between the eyebrows. We call those the 11s, just because it's two vertical lines that look like the number 11, or they can get horizontal lines across their forehead. So the best way to treat this is to sort of get to the root of the problem. So why are we getting it? It's from that expression. So if we can soften the muscle activity of frowning, raising the eyebrows, we can soften those lines. And the way we do that is with Botox. And to be more general, neuromodulator, there's different brands. There's Botox. We also carry a great brand called Xeomin, and they're pretty much just cousins of each other. They both work very well. And, if you're not too familiar with how Botox works, essentially, it's just a few little pokes. We use the smallest needle that exists. It's a little pinch, nothing bad at all. And then the Botox starts to kick in over a couple of days. So within 2 weeks, it's fully kicked in and you get those results, and they'll last for a few months.
Okay, great. Thank you, Dr. Levy. And Lesley, what would you say is the biggest misconception about Botox? Because I feel like there are a lot.
It's interesting. I find almost everyone gets confused with the difference between Botox and fillers. Botox is a neuromodulator. So basically, in the areas of our face where we have contraction. I find most people are just scared in general because they don't have the proper information about how Botox works, how safe it is, how long it's been applied and administered for. And Botox really isn't changing your face at all. It's just softening lines of contraction. So in the forehead area, the glabella, the 11s. And again, it does not change an individual's face.
Do you have any tips for people who are starting to notice fine lines, but maybe they're not ready for something like Botox?
Absolutely. Well, I am a firm believer of prevention being best.
Yeah.
So the younger we start, the better. Most important thing is starting with a good skincare routine at home, always applying an SPF, a daily moisturizer that has an SPF built in. So you're doing it unconsciously. It's not something that you have to make a note to say, oh, I didn't apply my sunscreen. Post 25 is when our collagen production slows down, our natural exfoliation process slows down. So starting treatments, the sooner the better. It doesn't have to be aggressive, and absolutely a good home care routine. Vitamin C is another one, and a retinol. Those are all great products to add in as young as possible, just to keep maintaining the natural exfoliation process, collagen production of the skin.
Okay, yeah, amazing. Okay, great advice from both of you. So thank you, Dr. Levy, and thank you, Lesley. Question number 3 comes from Andrea.
Hi, I'm wondering if you can help me. I'm 45 years old and I still get acne and breakouts. Is there anything that I can do to clear up before the holidays?
Dr. Levy?
Okay, couple things here. Yes, there's definitely hope. We can clear up your acne. We can always clear up the acne. It's just trying to find the right treatment that will treat the acne that you have.
A bit of trial and error.
Sometimes,
okay.
Right? Usually we can, nail it the first time, but sometimes we got to tinker a little bit.
Right.
Not everything works the same in everyone. Can we clear it up for the new year? Probably not totally. Okay. I mean, we're still, a month or so away. So often it could take 3 months to fully clear acne.
Okay.
And this is another common complaint is, people think, well, I'm not 15, I'm not 20, I'm not a teenager anymore. Why am I still getting acne? And I see 25-year-olds, 35-year-olds, 45-year-olds.
Yeah.
And I'm like, when is this going to end? So when people do tend to get more adult acne, if you will, there's usually a big hormonal component to it. And there's a great medication called spironolactone that I prescribe a lot, and it works very well to treat hormonal acne. The medication itself, it's not a hormone. It's actually a blood pressure medication, but it blocks the hormone receptor. And so it works very, very well to clear things up. And sometimes, you might have to increase the dose a little. Sometimes people, not commonly, but sometimes people get side effects and they can't tolerate it. But it is a pretty well tolerated medication. And I've had dozens and dozens of people come in. They said it's a game changer how it clears up their acne. So medication-wise, that's a good one.
Yeah.
And it depends. Maybe if it's more mild, we can treat with prescription creams. And there's all different ones that we can use for that, depending on the acne itself and what's been tried before. And then there's other things like doing a peel or doing a hydrofacial to sort of kind of clear out the pores and clear out that congestion. That can help for the acne too.
Okay, great. Question number 4 comes from Samantha.
My skin is so dry, and when I drink, it seems to be even worse. I'd love to get a fresh glow before some holiday parties. What can I do?
So what a great treatment is to get a nice fresh glow is to do a treatment that we have called hydrofacial. Hydrofacial exfoliates, it hydrates, and there's no downtime. So it's perfect to just pop into the office, get it done. It makes your skin look good and feel good, and you just carry on. There's no downtime at all.
You just walk out of Medcan and you look great, ready for your party.
Exactly.
Cool.
We can all use that.
Yeah. Say Samantha has 3 different parties. Could she get 3 different hydrofacials over the course of a few weeks, or is that something that you don't recommend getting often?
The results will last longer, than just a couple days.
Great.
So it's not a treatment that you'd have to repeat on a weekly basis.
Okay.
Maybe once a month.
Okay, that's pretty doable.
It is.
Any tips, Lesley?
Yep, absolutely. I always suggest, and especially during the party season, match each drink with a glass of water. Products with ingredients such as hyaluronic acid are extremely effective in adding moisture to our skin. They hold 1,000 times their weight in moisture. So very, very effective in extra hydration. Feels very light going on. So most people feel this isn't enough moisture, but it takes time. It trains your skin to retain and hold its own moisture. But oftentimes, because we live in a climate that's so changing and so extreme, changing our skincare routine from summer to winter is a really important thing, especially when heat gets turned on in buildings. It's also very dehydrating. Adding a humidifier to your bedrooms is extremely helpful. But in office, what we can do is I generally suggest peels or hydrofacials. I mean, hydrofacials are a really nice treatment for exfoliation and infusion. So that's the most important thing. We have to get the skin cells turning over. We have to get that top layer of dehydrated skin cells off in order for products to properly penetrate and in order to get that glow.
Okay, great news for Samantha. Thank you, Lesley. Thank you, Dr. Levy. Question 5 comes from Monica.
I'm turning 50 in the new year, and I'd like to refresh my skin over the holidays. I'll have a week or so off, and I'd like to tackle some wrinkles, spots, and general skin laxity. Any recommendations?
What do you think, Dr. Levy?
So there's different options here. I would tend to go with a laser. So here in the situation, they have that week off of work. So if they got the time off, doing something like CO2 laser would, you're going to get the results. You can afford to have the time off, where you're going to be a little bit red, or pretty red actually, over that time. Now, they're 50. They might not need CO2 laser. It might be a little bit aggressive.
Okay.
And it just depends on the person. Maybe they've spent 50 years, baking in the sun all year round sort of thing. Or maybe they've been really good in the sun or just have better genetics or whatever it is. And they don't necessarily need CO2. So doing the Clear and Brilliant, it's almost like a baby CO2 in a sense, sense that you're getting results, but you're not having that huge downtime. So, red for a couple days, but you can still go out. You're just going to be a little bit red.
And so the way that you take care of your skin in the sun, is that really the main indicator as to how it's going to look when you start to get 50, 60 and the wrinkles are there or maybe they're not?
I'd say it's the biggest factor in our control.
Oh, right.
So
okay.
Some people, they're just blessed with good skin.
Yep.
Also, the more fair our skin is, well, the more we have to be cautious in the sun.
Of course.
And I tell people, don't not go in the sun, live your life type of thing. But do your best when you are in the sun just to protect your skin from the sun. Putting on sunscreen. Usually I'll say SPF 50 for the face, 30 for the body, wearing a hat, covering up. If you're at the beach, sit in the shade. If you're doing an activity outdoors, try not to do it, say, between 10 a.m. and 2 p.m. because that's when UV radiation is strongest. You try to minimize those risk factors the best you can.
And so you should still be applying sunscreen like that through the winter. Is that true?
Yes. There still is UV radiation coming from the sun, and that's damaging all year round. It's not as strong in the wintertime. Would we benefit if we wore sunscreen all year round? For sure. Do you have to put SPF 50 on? Probably not 50. It could probably be a lower SPF in the middle of winter if you're in Toronto or Canada for that matter, but not as crucial as during the summertime.
Okay, good to know. And so For Monica, CO2 laser is what you'd recommend if she's got more intense issues, and that would clear up her wrinkles, her age spots, and her general skin laxity?
Yeah, and not as much the laxity, but definitely the wrinkles and the age spots. And I don't want to say totally clear up, but it will improve them, and it can improve them drastically. But I never like to say it's going to go away totally, because there still could be some finer lines, and there still could be some spots, age spots, but it will clear them up a lot.
And say she wanted to get a CO2 laser treatment and a Botox treatment. Could she do that at the same time, or would she need downtime in between those treatments?
With those two, I would not do Botox at the same time.
Okay.
Now, if it was a different laser, no problem. So if someone was getting IPL, they can get their IPL done and then get the Botox done 5 minutes later type of thing. But with CO2, because there's so much swelling in the skin, we just don't want the Botox to sort of shift around, if you will, and then we're not getting as precise of a result as we want.
Okay, good to know. Good advice there from Monica. Question 6 comes from Neil.
I generally wash my face and use SPF in the daytime and a light moisturizer before bed, and that's it. Now that I'm approaching 40, I know I should be doing more, but I'm not sure where to start. If I were to add one product to my routine, what should it be?
Can I cheat and add 2?
Oh my gosh, I'm sure Neil would love to hear 2.
Yeah. So I'd say 2 main things. In the morning, we want to put on an antioxidant, so a vitamin C cream or serum. That would be best for the morning time. And then for the nighttime, using a retinol cream.
Okay. What does a vitamin C do, and what does a retinol cream do?
So the vitamin C is more antioxidant. So especially as we're going out during our day and there could be pollutants in the air. So it helps protect our skin a little bit that way. And the retinol is more anti-aging.
And what does it do to your skin?
So retinol does a few things. It helps with cellular turnover. It also helps, this is getting a little technical, but it can help with transfer of pigment from the pigment cells into the skin.
Okay.
So it can help subtly with sunspots.
How long does it take for results to start showing up if Neil was to start using these products tomorrow?
Should start to see results within the first couple weeks.
Awesome.
Yeah. So we have SkinCeuticals, Zenobaji, and another brand called Skin Better, all of which are excellent. Some of these we have retinols, and there's different strengths of retinols. They all make vitamin C creams.
And so should you start with a higher level retinol, or is it best to work your way up? Or is that something that Neil should best talk to maybe an esthetician or yourself about?
If you're sort of retinol naive, meaning you've never used one before, start low.
Okay.
And then you can work your way up.
I find a lot of people come in, they say, oh no, I've tried a retinol, my skin peeled so much, it was so sore. There is a way of adding it into your routine where you build up a tolerance to it. And that's basically only starting a few nights a week, sandwiching it in a moisturizer. So applying something like a hyaluronic acid serum, applying your retinol, and then applying a moisturizer on top. This is something that's preventative, and it also treats. So it's probably one of the most important things outside of sunscreen that you can add into your routine if you're looking for anti-aging, you're looking for anti-acne, fine lines, discoloration, pigmentation. It checks all the boxes.
Thank you, Lesley. Next question comes from Juliana.
I've gotten facials in the past, but I'd like to try something that has longer lasting results. I was wondering if you could suggest something that would make my dull and dry skin look a little bit more hydrated and young. And bonus points if you could suggest something that would make a difference after just one treatment.
Dr. Levy?
Lots of options here, but one thing we haven't touched upon too much so far is doing a professional peel. And there's different types of peels. One great one is doing a glycolic acid peel. You know, the question here is saying, you know, would it look good after one? You'll see results after one, but where you really get the best results is if you do a few of them. So if you do, you know, you're doing it every few weeks, you know, several sessions is where you'll sort of get the best results and where you'll get that best glow and your skin will be at its finest. That would be a great option for Juliana.
Okay, sounds good, but something called a chemical peel sounds like it hurts.
Absolutely. And a lot of people are scared because of that. And that's why we don't like to refer to them as chemical peels. We like to refer to them as professional peels. In our office, it's very tailored to the individual. Most of them are naturally occurring acids that we choose from. So someone who's coming in who's 16, who's battling blackheads, whiteheads, melia, acne, we're not going to use the same acid that we would use on someone who's coming in who has an older, thicker skin with more elastosis, more sun damage. We're going to choose based on the individual. It's applied, it's usually a bit of a sting. It's on for 1 to 5 minutes and then neutralized. So it's not a very long contact time where you're feeling that sting. It's a very short part of the overall treatment. However, I always will recommend to patients, yes, you will get a glow, but don't ever do any in-office treatments within 10 days of a very important event. You never know what could happen, and I find most treatments, your skin has that glow generally about 10 days post. So it's always good for people to keep in mind if they have a really important event, book it ahead of time, just in case. You never know. And I would hate to do a treatment on someone and then they have a little bit more peeling, they have a little bit more dryness, which can ultimately happen depending on the skin for a couple of days post. And they're feeling self-conscious about that at an important function.
Thanks, Lesley. Okay, great. Our next question comes from Brian.
Hey, how's it going? I've lost a lot of weight recently, and it's very noticeable in my face. Is there any alternative to boost collagen through a treatment rather than fillers? Appreciate it. Thank you.
Dr. Levy?
There's a nice treatment called Althera. It's actually indicated as a non-surgical facelift. It gives you that lift without having to go under the knife. You know, we're not talking about getting plastic surgery, not getting fillers. And fillers can be done and they can look very natural. And that's always the goal, is just to give a natural look. But, you know, if you didn't want to do filler, Althera could be a good option for him. Again, without having seen Brian, a photo of him or seeing him in person, Althera would give a nice lift. And usually we'll do a couple sessions of that.
So what is Althera? What sort of treatment is it?
So Althera, it uses ultrasound and it targets the skin and the tissue under the skin to tighten it and boost collagen and to provide a lift.
Okay. But obviously consultation is best before.
Always, yeah. Althera is not something I'd recommend for everyone because some people, they may not need it or it might not give them the results they're hoping to get either.
The treatment itself, if someone is looking for information out there, is called Ultherapy. The reason why it is called Ultherapy is Ultherapy harnesses the technology of ultrasound. It is a non-ablative process that basically uses the heat from ultrasound waves to stimulate your body's own natural healing mechanism. Tell the body that this is what you need to do. You need to heal yourself. And in doing that, you will notice, again, improved texture, tone, tightening, and lift. And this is what Ultherapy does with very little to no downtime. Because what we're doing is we are wounding the skin in a controlled manner. It takes approximately 6 months. And there are some studies now that even up to 1 year post-treatment, individuals are getting results from the actual treatment.
Okay, great. Time for our last question. It comes from Erin.
Okay, so I've tried every product and concealer to deal with my dark circles and nothing seems to work. Even sleep. Is there a treatment that can lighten the dark areas under my eyes?
Okay, dark circles. Help Erin out, Dr. Levy.
Yeah. Again, this is someone where you have to see them in person, but there's a few different options here of what could work. So starting from the least invasive would be just using an eye cream. And there's a lot of eye creams out there on the market.
Yeah.
And everyone's going to say, oh, this one works, mine's the best sort of thing. So eye creams going on that ladder, treatment ladder, that's number one. Sometimes people get shadows because they have a little bit of hollowness under the eyes. And then you get the shadow effect. So it looks like there's dark circles, but it's accentuated by the volume loss and they get the shadowing. So by putting a little filler in the tear trough area, so under the eye, we're nowhere near the eye, we're under the eye there on the cheek, that can give a little bit of lift and it takes away that shadowing.
Okay.
And then in some people, they got bags under their eyes.
Right.
And you're going to get dark circles with that. And again, eye creams can help. The filler's not going to help in that situation. It's not getting rid of the eye bag. The treatment for that would be surgery. And it's not major surgery. It's called a blepharoplasty. And what that is they cut away some of the excess skin. And if there's a little bit of a fat pocket, that's sort of bulging out under the skin, they take that out just to tighten things up. And that can be much more definitive treatment if someone has bags under their eyes more so.
And do you know what causes bags under the eyes?
I mean, a lot of it's just genetics.
Okay.
I'd say that's the main thing.
Yeah.
You know, you don't get a good sleep one night sort of thing. Okay, that can cause a bag. But if you got the bag every day and it's been there for years, it's usually not a lack of sleep. You know, that's not the only cause for it.
Okay, sounds good. And Lesley, what would you tell Erin?
So if it's a pigmentation issue, all of the treatments that we do to address pigmentation will help. You know, treatments like the IPL, treatments like professional peels, treatments like Clear and Brilliant. And we can generally get quite high up under the eyes.
Mm-hmm.
If it's a vascular issue, which means there's a congestion of blood vessels underneath the eyes, which is most common, then we have to address if we are able to safely treat the veins and vessels under the eyes in order to lessen the dark circles. We have to get to the root of the cause and then properly diagnose and assess whether we are able to get an individual results that they'd be happy with.
And are there any products that you'd recommend to help with dark circles in the meantime?
There are many eye creams on the market that claim to help. They may have, ingredients such as kojic acid. They may have ingredients, mild retinols, things like that. So there are products that can help. If it is a pigmentary issue or a dehydration issue, they can help. If it's a vascular issue, then most of the time you're looking just at vascular lasers in order to help seal off those vessels.
Okay, so depending on her particular type of dark circles, those are Erin's options.
Exactly.
But it does sound like, I mean, no matter how much time you have, whether you have an afternoon or you have a week, you have 2 weeks, there are treatments that exist that can probably help you.
There's always something we can do.
Okay, so before we close out, Lesley, do you have any last tips for keeping your skin healthy through the winter?
So the most important thing is, again, upping your hydration, adding products that are heavier, slightly more moisturizing in the winter, and add an exfoliant of some sort. Whether that's a retinol, it can be in an alpha hydroxy acid form, it can be in a very, very fine micro scrub type form, but you want to just basically be upping your exfoliation, adding in hydrating masks once a week, things like that, upping your moisture content, drinking more water.
Okay.
Those are all helpful to get us through the winter.
Yeah, and feel free, we have 3 great skin consultants.
Okay.
So can reach out to them and they can provide you some more info. And there's no charge to meet with them.
Thank you both so much for being here. This has been a pleasure.
My pleasure. It's great being on here.
That was our special holiday skincare episode featuring Refine by Medcan Medical Director Dr. Jonathan Levy and esthetician Lesley Bray.
For more information about how Medcan can help you achieve your skincare goals, call 416-350-3621 or email refine@medcan.com.
Follow Medcan on Twitter and Instagram at MedcanLiveWell. We'll post episode highlights and links you can visit on our website at eatmovethinkpodcast.com.
Say hello and send us a tip or a suggestion by emailing us at info@eatmovethinkpodcast.com.
Eat Move Think is produced by Ghost Bureau. Jasmine Ratch is managing producer. Social media and strategy support is from Chantal Gertan, Andrew Imax, and Emily Bozek. Executive producer is me, Christopher Shulgin.
We'll be back soon with a new episode examining the latest in health and wellness.
This podcast is intended to provide general information about health and wellness only and is not designed or intended to constitute or be used as a substitute for medical advice, treatment, or diagnosis. You should always talk to your Medcan healthcare provider for individual medical advice, diagnosis, and treatment, including your specific health and wellness needs. This podcast is based on the information available at the time of preparation and is only accurate and current as of that date. Source information and recommendations are subject to change based on scientific evidence as it evolves over time. Medcan is not responsible for future changes or updates to the information and recommendations and assumes no obligation to update based on future developments. Reference to or mention of specific treatments or therapies does not constitute or imply a recommendation or endorsement. The links provided within the associated document are to assist the reader with the specific information highlighted. Any third-party links are not endorsed by Medcan.